Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine-based physician who's an endocrinologist. Today, I have a very special guest. Her name is Dr. Jill Carnahan. She is going to help us unpack and unravel how the gut and simple things like water, air, and food quality play into chronic illnesses. I picked Dr. Jill to be on my podcast because she, like myself, became interested in this field as a patient herself. She's going to tell you about how she was diagnosed with a very aggressive breast cancer at age 25 and then developed Crohn's disease. She has actually created an amazing documentary about this where she talks about being a patient and a provider. And she also has a book called Unexpected: Finding Resilience Through Functional Medicine, Science, and Faith that was published a couple years ago. I think she's a phenomenal person. And in this episode, we really focus on how the quality of your air matters and what to do about that, the quality of your water, your food, your mind, your body. She gives us tons of very specific and easy tips on how to make this better. She explains the difference between exotoxins or toxins outside of our body versus endotoxins. Our gut releases a lot of toxins. This is why gut is so important. And so we talk about leaky gut and toxins in your gut and what to do about that. And she does share some information about mold as well. She also talks about how she calls it your bucket of health, when it is overflowing with toxins and you have too many things going on in your body, can't get rid of the toxins that you have, you typically present with three things: dementia or cognitive impairment, autoimmune type conditions, Hashimoto's, Crohn's, rheumatoid arthritis, etc., or cancer. And so we talk about how to remove some of the water from our toxic burden bucket so that we don't end up with these symptoms. So I think she does a fascinating job explaining this, you guys. So Dr. Jill Carnahan is your functional medicine expert, dually board certified in family medicine for 10 years and integrative holistic medicine since 2015. She's a medical director of a functional medicine clinic that's widely sought after in the Colorado area. She does functional medicine protocols, nutritional consultations, chiropractic therapy, and acupuncture, along with massage therapy. Again, she's a survivor of breast cancer, Crohn's disease, and toxic mold illness, and she brings a unique perspective to treating patients in the midst of complex and chronic illnesses. Her clinic specializes in searching for the underlying triggers that contribute to illness through cutting-edge lab testing and tailoring the intervention to specific needs. I'm going to link all of her stuff in the show notes because she does have a fascinating documentary called Doctor Patient, and she has a book that I would love for you guys to check out. So let's get into this conversation so you can learn more about how to help lower your toxic burden and be a better, healthier person. So thank you for joining me today, Dr. Jill Carnahan. I am so excited for you to talk to my guest about your journey through just health in general. And then what I really want to focus on with you, since you're such a good expert with mold and chronic illness, is how sometimes we forget about the gut, if that's okay with you.
Yes, I love talking about the gut. I'm super excited to be here with you, Cassie.
Okay, thank you so much. So will you kind of tell listeners to start with, I like them to understand like who you are, where you're coming from. So obviously we're going to link all your stuff in the show notes, but like, what do you do every day? How did you get here? What do you love to do? Like just a little bit about you so they understand who is talking to them.
Yeah, so I grew up on a farm in central Illinois, one of five children, really kind of an idyllic life, and decided to go into medicine, kind of surprisingly so, because there was no one in my family in medicine. I kind of knew at some root there was a healer in me, and I actually chose to go to allopathic conventional medical school just because I felt like at the moment it was the best reimbursable system to kind of learn the system, but I really came from a much more holistic minded background. I mean, we grew a lot of our own fruits and vegetables, and kind of unbeknownst to me, this farm life, which was kind of wonderful and idyllic, was slowly killing me. And I didn't realize it until in my third year of medical training, I found a lump in my breast and went on to have surgery, biopsy, and find out that at 25 years old, just days after my 25th birthday, I had aggressive breast cancer. So that obviously kind of threw me for a loop, was not expecting that diagnosis. Went through very aggressive chemotherapy, radiation, surgery. In fact, I was the youngest one ever diagnosed at the Loyola University Medical School where I was training. Now, sadly, since then, there's been a lot of young women diagnosed, so I'm not unique. But at the time, it was pretty much a shock and a really big deal. And then, speaking of the gut, I got through all of that chemotherapy, radiation, lost all my hair. It was quite a battle. And 9 months later, I returned to medical training to finish my degree. And shortly after, maybe 6 months or so, I was taking a patient's blood pressure in the emergency room and I passed out. And I was rushed into emergency surgery. And I got out of the surgery, and my surgeon told me I had Crohn's disease. So, in medical school, two kind of life threatening, massively life shifting diagnoses. And I tell that because it was really my journey as patient that informed me probably even more than my medical education, and specifically on the topic you want to talk about today, and that's gut health, because I was able to really dive deep into the gut and reverse my Crohn's disease.
So that's such a sad, unfortunate story. I'm sorry that that happened to you, but I feel like a lot of providers, like that's why we end up here, right? So you unfortunately had this diagnosis at a young age, and then it, propels you into doing all the great things that you do for people. But you did have two pretty aggressive diseases that, if we really look at it, a lot of times maybe stems from not only environmental toxins, somewhat genetic, but a lot of it can be from your gut too. And so I know you actually have a documentary and you have a book where you kind of talk about this. And your documentary, I think, is very fascinating. So it's about, your perspective from the patient and the doctor's point of view as being pretty much like a chronically sick person. Is that right?
Yeah, the documentary really dive into like how does it feel to be dealing with mold-related illness, Crohn's disease, cancer, and telling the story. And really, we follow along with a couple other patients' journeys as well. And what's really interesting in the documentary, we go pretty deep in the end about how do we transform our relationship with ourselves and our identity and, relationships. I went through a divorce at the end of all this, and we talk about like how sometimes those healing our old traumas can be just as powerful as healing the gut or healing the cancer cells or those kinds of things.
Yeah. So we'll link everything for the documentary and the book. But I want, so your day to day, like what you do now, you work with pretty sick patients with mostly mold, or what sort of patients do you work with?
Yes, I have a clinical practice in Louisville, Colorado, just next to Boulder, Colorado, and I have a PA there as well, and we both see complex chronic patients who kind of have had mysterious symptoms. A lot of it ends up being autoimmune disease. We do deal with some cancer, definitely a lot of gut disorders, hormonal disruptions, and those kinds of things. But what I frame it as is at the root of most of the complex chronic diseases that I see is some combination of toxic load and infectious burden, and how those two interplay with the immune system creating inflammation. And the gut is kind of at the core there too, because that's where we absorb nutrition and where a lot of our immune system meets the outside world. So I love talking about the gut because I feel like it's really ground zero for inflammation, autoimmunity, chronic infections, and immune dysfunction.
Yeah, I think that's so fascinating. So with you and your personal journey, you mentioned at 25 you ended up with this aggressive breast cancer, and you feel like some of it was from the farm that you lived on. So can you kind of, explain or talk about that a little bit more in depth? Like, what do you think it was that led to you having not only aggressive breast cancer, but then Crohn's disease as well?
Yeah, so I always think of toxic load as a bucket capacity that we're born with, and people have heard this before, but some of us, like myself, were born with a much smaller bucket or capacity to detoxify those things that we all come in contact with every day, whether it's pesticides on our food, or the air quality, wildfire smoke, or mold in our homes, or any number of things, heavy metals, mercury amalgams. All these things we come in contact with, and nowadays it's parabens and phthalates in our makeup, bath, and beauty products, or it's polyfluorinated compounds on our takeout food containers, and I could go on and on, but it's all over. We're all exposed to it. And what happens is, as we have that toxic load, our ability to detoxify day to day, if it's a small capacity due to genetic variances, then all of a sudden that load in the bucket starts to fill up and spill over the top over a lifetime. And for me, it started to spill over with cancer at 25. And some people, fortunately, go a lot longer in their 50s or 60s till they develop disease. But all of this happens, and frequently when that bucket starts to fill to overflowing, we present with three things that are really increasing in incidence. And one is neurodegenerative diseases like Parkinson's, Alzheimer's, dementia, and things like autoimmunity, which encompasses Hashimoto's thyroiditis and lupus and multiple sclerosis and rheumatoid arthritis and any number of autoimmunities. And then also cancer, which was my diagnosis at 25. So this bucket of things that comes from our environmental toxic load, and truly at the core can come from our gut, was part of the things I experienced on the farm, because there was atrazine sprayed on the crops, and our well water probably had contamination from other chemicals, and glyphosate's a big one, Roundup, which massively affects our gut. So all the things were happening unbeknownst to me. And if I look back, I probably even got in utero exposure because my mother was drinking the same well water and getting those same exposures. And the year that I was diagnosed with cancer, there was a study of cord blood of infants born, and they tested brand new babies and if they had toxic chemicals, and all of them tested had an average of over 200 toxic chemicals on birth. So again, this was kind of crazy. That's 20 years ago. So it's only becoming more and more prevalent that we're exposed to these toxins. And for me, that exposure, probably some of it on the farm, was likely a precursor to my cancer at 25.
Yeah, I like that analogy, the bucket. I think that that's really cool. And so you feel like you had a lot of things that were put into your bucket when you were younger, all these toxic chemicals and different things like that. So for people who are listening, what can we do to help empty our bucket, right? So our body is supposed to be made to process toxins. I mean, obviously you don't want to be in the middle of toxins if you can avoid it, right? So like mold, I see a lot of people with mold. I know you do as well. The number 1, 2, 3, 4, and 5 treatment for mold is to get out of the get out of the environment, right? Like you can buy and sell and take whatever sort of, binder or whatever somebody wants to sell you, but until you leave that environment, you're going to be sick. So what can somebody do besides trying to leave that environment, right? Like we can't live in a bubble, and there are all these things in the environment. So what do we do to help lower our toxic burden? Like how do we throw some of this stuff out of the bucket?
Yeah, it's so important because sometimes when you talk about environmental toxic load, which is kind of my shtick, it can be overwhelming and depressing. And so I always want to come with simple answers. And while it'd be great if everyone could see a functional doctor and test this, you don't have to even know what's in your bucket to start the process, because all of us have toxic load. And like I said, as the water level goes up and starts to spill over the top, we might present with issues, immune issues, gut issues, or just brain fog or fatigue or symptoms that don't even have a specific diagnosis. But we all have the capacity to start to lower that water level, which I'll tell you some very practical tips, because as soon as we create margin in that bucket, our body starts to detox and heal and be able to overcome this. So all we need to do is create margin. And some of the principles, I always like to start with clean air, clean water, clean food, and then maybe clean mind and clean body. So clean air, about 80% of our environmental toxic load comes from the air that we breathe. And people are not aware of this, they're not thinking about it. And some of the examples would be, as you mentioned, mold is a really big deal for a lot of people. And you could be in this home, like this condo where I live, and there's mold behind the wall, excreting mycotoxins, affecting the air quality. I don't even know it, except that I have brain fog or fatigue or rashes or hormonal disruptions, or as we started the conversation, gut issues is really common with mold exposure, or wildfires. In my state of Colorado, they're really common and increasingly so in many states. And this toxic smoke from wildfires is a really big inflammatory thing that affects us. So say there's wildfires happening, we should not be running and exercising outdoors because it's so toxic to breathe in that smoke. And most of this, whether it's mold, mycotoxins, or toxic wildfire smoke, a lot of this particulate matter is 1.0 or 2.5 microns, which is so small that if we inhale that, it goes directly into our alveoli and into the bloodstream almost immediately, because there's no barrier that can catch those particles that small. So what we want to do with clean air is make sure that our indoor air is filtered, make sure that we have good airflow exchange, make sure that we put high quality carbon filters into our furnace or whatever our HVAC system or system of airflow or air exchange. Exchanging air from the outside is good, so opening your windows when there's not wildfires outside is a great way to dilute the pollution indoors. And sadly, with our very efficient buildings nowadays, our fast construction, and some of the ways that we're building offices and homes nowadays, there is a lot more risk of toxic indoor air. So you want to make sure, like I said, that air exchange, that you have good filters. I have a bunch of standalone filters, like IQ Air or Austin Air or any of those high quality filtration systems. You want to make sure you have a HEPA filter, which filters particulate, but also a VOC filter, which filters out volatile organic compounds. And then that's clean air. Clean water is pretty self-explanatory. You want to make sure you're drinking filtered water. If you're, have a well or have city water, a lot of times those are not as clean as we think. So I'm a big fan of either a reverse osmosis system in your home or just a fridge filter, a simple pitcher that will filter out all the toxic chemicals and things. PFAOs are now in many water sources and also in public water. Those are polyfluorinated compounds or forever chemicals. So you need to make sure you have filtered water whenever possible. Try to avoid plastic water bottles. Plastics are becoming increasingly common in our bodies. So clean air, clean water, clean food, just sourcing as much as possible from local organic farmers. If you can get, grass-fed, pasture-raised animal products, and of course, organic fruits and vegetables are always a good source of nutrition.
So how much did you say air made up of our toxic environment?
80% of our
That's what I
environment.
thought you said. That is crazy.
It is,
That
isn't
is
it?
so crazy. Yeah, and when you were so clean air is so important. Until I did a podcast episode, I did one with the Toxic Dad, and then I actually did one with the founder of Jasper Air Filters. I never really thought about air, right? So I'm like thinking about your mitochondria and your gut and your hormones and your sleep. And then I was like, duh, Cassie, like to your point, you have a single layer of cells in your lung and what you're breathing in. I mean, it's just instantly going in there. And what really made me think about it was I have seen some really sick people recently from mold. I mean, really sick. And kids, oh my gosh, kids get sick like bad quickly. And so the air is just really, really important. And to your point, it's hard because like if you live somewhere where there are fires and you can't go outside, or are you living somewhere, with mold, it's just really hard to make sure that the air is clean. I will tell you, I got a Jasper air filtration system for my bedroom and for my kitchen. I'm also shocked at how many times that thing goes off when I cook. Like when you cook things, it gets angry. But I recently traveled and I had been sleeping in my bedroom with this Jasper air filter for several months. And I got to this hotel and I'm like, this room smells weird. Like I was just everything, like I couldn't figure it out. I was going to bed. I've become an air snob, Dr. Jill.
I
Like
know.
the air is not right in this vicinity. Like what is wrong with the air? And I don't think it was anything with the hotel. I really don't think they had mold or anything. It was a nice hotel, but I was just like, I don't have my like clean filtered air.
You do get used to, like in my office, I think I have 5 air filters. And I remember even during COVID, people would walk in. And first of all, some of these great air filters with VOC filter out virus particles. Like that's cool. So we had a very, very clean office, like almost as sterile as a hospital system. And people would walk in like, oh, it almost tastes the air. It's so clean. It's so weird. Because when you get used to that, you really can tell. And sadly, most hotels use cleaners and stuff between, and again, it may not even be mold. And just as a tip or trick, if you smell like a mildewy smell, a musty smell, or I always notice it's almost like a dirty smell, that's mold. Like people just like I've walked into hotels, I'm like, oh my gosh, that's mold. But it's not always, it can be musty or mildewy. Sometimes it's just like this dirty, earthy smell. And when you start to identify that, you realize how many places sadly have issues with mold.
Yeah. So what do you recommend if you go to a hotel and you smell mold? Do you recommend switching rooms? Do you recommend switching hotels? Like, what do you do about that?
Yeah, and I travel a lot, so I've experienced a lot. A couple of things. I do have a portable air filter that I sometimes take with me, depending on how long I'm going, or if it's like an Airbnb and I want, in my bedroom. So you can get portable air filters. They're a little bit cumbersome. Often I try to check that the hotel or again Airbnbs can have this too, where you can open windows because dilution is the solution to pollution. So even if you have a room that's kind of musty or there's a problem, as long as you can open windows, you're probably going to be okay because you can really pull that air and or turn on the fans or things. If it's a real significant smell, ask for another room. And you just have to be, polite, but also ask for another room because it really does make a difference, especially if you're there for multiple days. And I've had hotels where it's so bad, I feel so awful that I need to either move rooms or leave early. And just don't be afraid to make requests if needed because it's not worth your health to stay in that place.
Yeah, I was very upset. We went somewhere for my birthday recently, beautiful hotel in Hawaii, beautiful. We walked into that hotel and I told my husband, this entire hotel smells like mold. And they put us in a room and I was like, I'm going to vomit. Like it was so bad. And beautiful hotel, could see the beach, but it's just like you could tell that it had some serious mold issues. And I got like almost to where I just didn't feel well when I was there. And it was kind of sad because I was like, not only does this need to be fixed, but they also need to get like some Jasper air filtration system or something. And it kind of ruined my experience of Hawaii. Like I never want to go back, which also makes me sad because people are like, oh, I love Hawaii. And I was like, really? Because I felt like crap the whole time and it was pretty, but I never want to go back. Like,
I
I
have
don't
a
know.
very similar, and I've been to Hawaii multiple times, not every time, but there was one time that was so awful with the mold, and it affected my mood, it affected my energy. Like it really, like you said, it really colored the trip significantly.
Yeah, I would try to go outside all day and like sit under the shade and I felt better. But anytime I was in the room and then, you have to sleep in your room. And I'm like, man, you're paying $1 bazillion for your room because you're in Hawaii. I was just kind of annoyed. But I did like, my husband calls me a creeper. I was like walking around on every floor trying to smell if there was a different floor that smelled better, but it all smelled bad. So I was like, I don't even know that it's worth like moving anywhere. And then to go back to your comment about plastics, have you heard that people have about the size of a credit card worth of plastic in their brain?
Yeah, I was going to mention that stat because it is true, and it's so crazy when you think about that. It's such a practical way to like visualize how much plastic that we're getting. I think it's the consumption per week in the foods that we eat and the drinks that we drink is a credit card. So this is per week. That's insane. And there's really no, this is what's crazy. I mean, I do environmental toxic medicine as a practice, and plastics, whereas like mold, you can use binders, you can use clay, charcoal, polyphenols, all kinds of stuff to help kind of get that out of your body. Plastics, there's not like a charge that we can use or a particulate. I think now the only thing that we know is plasma exchange, which is a pretty intensive protocol to basically an oil change for your blood. That could take plastics out, but I think we're going to have to get more aggressive by either avoiding plastics more thoroughly or using these things like plasma exchange because it's going to be hard. There's no binder that pulls out plastic.
Yeah, and so you think we get most of this from food?
I think it's in rainwater now, and so even like fish and animals can have plastics in their tissues, and then of course any plastic water bottle is shedding, so that's why I'm like, please don't. And of course I travel, so sometimes I use plastic water bottles, but more and more I take my own and fill it up and try my best to avoid plastic. But it's hard because in food wraps and things, so if you're getting any sort of like cheese or fatty food that's wrapped in plastics, so it's a lot through our food supply. And again, now it's in our rainwater and in our, fish and oceans. And so it's pretty prevalent in our ecosystem now.
Yeah, and when I travel, I use Path water bottles. I love those aluminum water bottles. I don't know if those are good or not, but better than plastic. And then actually, I talked to somebody recently. I know somebody who knows a lot about dry cleaning and clothes and different things like that. They were explaining to me, I never knew this, that a lot of different clothing, if it's not cotton, right? So if it's polyester, it's plastic. I didn't realize that. And there's different types of polyester, like recycled versus not. And I guess the recycled ones are better for you, but really cheap clothing that's made out of cheap polyester is just giving you like all sorts of plastic through your skin, which is insane, right? And a lot of this is what we work out in, right? So like I've heard that Lululemon is one of the most notorious for putting all these chemicals in their clothes, and then you wear those and you sweat. And you sweat in all sorts of parts, especially as a woman, that are reproductively important. And then you have all these plastics and bad things going straight into your skin.
That's funny. I wasn't going to mention the brand, but that's exactly, you read my mind. I was thinking the exact same thing. And then you wash these, and every time we do laundry, that sheds into our water supply. And so it's getting like, as that wastewater is being put back into the sewage treatment plants or the water supply, those plastics are shedding out of our laundry into the water supply and into the drinking water and things like that. Eventually, as we, filter the water. Now, a good filtration system or a good pitcher, some of these like the ones that I use in my fridge at home, they do filter out microplastics. So that's another great way to filter it. But you're right, we're getting it through our clothing too.
So what water pitcher do you use?
I use Clearly Filtered. It's been shown, I think, over 200 chemicals, including plastics and PFAOs, and not as many of them are doing the plastics and PFAOs.
Clearly filtered?
Clearly Filtered, yeah. They make water bottles that are stainless steel that you can take with you and filter your water. Or in my fridge, I just have one of their pitchers.
Okay. What about workout stuff? Do you have like a brand that you like?
Oh gosh, I'm guilty of some of the commercial brands, I mean, certainly the cotton, if you can get it. The difficulty is we like these stretchy, lycra-like, the stuff that feels good and looks good. And so, sadly, I think, not that cotton can't have that, but the stretchiness that you get and this good form-fitting stuff comes from polyester and plastics. Cotton doesn't stretch the same way. So if you want a material that's like 100% organic cotton, it's not going to have the same elasticity that you're used to. So you just got to get used to a different texture.
Yeah. So then those are all great things. You talked about air, water, food, mind, and body. And I think a lot of that, this is why I talk about the gut a lot too. I see a lot of people who are not only chronically ill, like physically ill, fatigued, like can't get out of bed, gaining weight, but when you're sick for a long time and or your gut is dysregulated, your mood is not normal either, right? And so I kind of want to talk about how all these things affect your gut or your gut affects all of these things. And then also talk about for people who are listening, how you can do simple things like sleep and eat well and see sunshine and have, good relationships, make sure that you're practicing gratitude, things like that. So I want you to kind of talk from your environmental standpoint about how the gut is important with these things and sort of what do you see as far as gut diseases, and then, what are some of these things that we can do to make that better?
Yeah, so gut is ground zero for so much of this. And we talk about toxic load. Many people are thinking about the PFAOs, the plastics, the parabens, the phthalates, the metals, but they're not thinking about those are exotoxins. Those are from outside our body, within, from the air, the water, the food, etc. We just got done talking about that. But what many people don't realize is endotoxins can come from within, from our gut. So in our gut, we have microbiome, we have bacteria, some people have fungi and fungus and other things. We can have parasites. And all of these things are producing metabolic waste products. And things like the coatings of bacteria, also called LPS or lipopolysaccharide, these things actually can be toxins from within. So if we have an excess of bacteria, especially in the small bowel where we have a highly absorptive surface, and we have some permeability, which most of us have just due to, again, toxic load and impaired membranes and things in the gut, a lot of these toxic metabolites leak from the gut lumen into our bloodstream and create immune inflammation, toxic overload from within. And again, these are called endotoxins coming from inside out. And a lot of the metabolic byproducts of bacteria and yeast are very toxic to our system. So it's actually not uncommon to have a toxic load partially from our gut microbiome. So one of the first things I like to do for patients overall is just check a stool test, check organic acids, and assess the microbiome to see is there any dysbiosis, is there any organisms like Klebsiella, Citrobacter, Candida, or other even Saccharomyces cerevisiae, which is brewer's yeast. Any of these things in excess can be contributing to that toxic load from inside out. And the first step is to eradicate any invaders, anything that's not supposed to be there. And then sometimes there's even good guys in excess in the wrong location, as in the example of SIBO. This is small intestinal bacterial overgrowth, which can cause symptoms from IBS like gas or bloating or diarrhea or constipation. And it affects the absorptive surface of the small bowel. So you can have fat-soluble nutrient deficiencies like K, A, D, vitamin E, and even low iron or low B12. And so those are some of the signs and symptoms: gas and bloating, diarrhea, constipation, maybe heartburn, maybe fat-soluble nutrient deficiencies that can signify that you have a problem with overgrowth of bacteria. There's also an overgrowth of fungus that can occur in some people, again, Candida or other species. This can cause carb cravings, brain fog, hormone intolerances, and bloating, weight gain. And interestingly, yeast produce a toxic metabolite called acetaldehyde, which is very similar to formaldehyde, that can cause a hangover-like feeling. It's the same thing if you drink too much alcohol, your liver processes the alcohol into acetaldehyde. So it's very similar to feeling like you're hungover, and that can happen from yeast. So the first step is eradicating those excess bacteria. You want to put in the good probiotics, you want to get rid of the bad microbiome species, and you want to really balance that gut permeability. You want to heal that leaky gut. And it starts with food. Food is the fodder to feed the microbiome. So healthy fiber, absorbable and non-absorbable, things like inulin or polysaccharides, or even just colorful fruits and vegetables. things like flax and chia and hemp seed, and just fibers from all your typical vegetables like leafy greens and broccoli and garlic and onion and artichoke, and all those things contain healthy fiber to feed the good, healthy microbiome.
Yeah, I think those are all great tips. So thank you for explaining that to everyone. So that when you're doing that and you're making sure everything is balanced and you don't have this overgrowth, the other thing I like people to understand, or what I like to point out, is like when your gut isn't working how it's supposed to, and you have this overgrowth in your small bowel, or you have these yeasts or different things that aren't supposed to be there that are causing these symptoms, and you start getting what we call leaky gut. What people I don't think they put together is that if your gut's leaking and it has all these small holes in it, right? And all these bad things are leaking out of your gut into your bloodstream, that's where we really start developing symptoms and having issues, because our GI tract was made to be this closed tube from our mouth to our anus. So we put food into it, we absorb the nutrients we need, and whatever's bad comes out. We aren't meant to take large amounts of particles, things that aren't nutrients, and have them absorb into our bloodstream, right? And so 70% of our immune system lives in our gut, at least 70 to 80. And when you have all these tiny holes in your GI tract everywhere, and you have these things like microplastics and red food dyes and blue food dyes and fillers and all these things leaking out every time you eat, your immune system is freaking out. It's like, what is attacking me? I don't even know what this particle is, right? And so your immune system's constantly on alert, and it's, stressed out every time you eat. And then that causes your cortisol, which is a hormone that helps your body regulate stress, go up. And when cortisol is high, then, which is the hormone that would be high if you saw, a lion, to run away from a lion, it's your keep you safe hormone. Then that causes your insulin to be high so that your body can release stored energy from places so that you can run away from the lion. And so now your insulin's high, but when that's high for a long time, that starts to cause you to store things into fat. And, instead of your metabolism working correctly. And so all these things start to happen in your gut, which we could just, then now your cortisol and insulin are high. So now your brain is stressed out, your body's stressed out. It's going to say, oh, don't make thyroid hormone, don't make growth hormone, don't make sex hormones. It doesn't matter if we sleep well. It doesn't matter if we, reproduce right now. All we need to do is be running away from this lion. But this lion is really just the food that you're eating constantly over and over and over. And these levels never go down. And so your gut is just wreaking havoc on your body. So you start to develop all the symptoms you were talking about, the, Alzheimer's, dementia, the autoimmune conditions, the cancer, because your body just feels like it's being attacked all the time, right? And so people don't always put this together. Like we hear all these things about gut, but people are like, does it really matter? And I think sometimes, people will eat well for a month, right? We put them on some sort of diet. We make them eat well for a month. They may not feel wonderful because, to your point, they have bacterial overgrowth, or they have something else going on, or maybe they do have molds. Maybe they're breathing bad air. And so people are just like, screw it, I'm going to go back to eating McDonald's. And, but it does really matter, right? Like it matters for your overall health, and it matters for not only your physical symptoms, but your mental health as well. And so I don't think that people put that together. Does that make sense?
I totally agree. It's this thing we just take for granted. And because food is easily, fast, available, conveniently, it takes more time to plan and think about. Like for airport travel, we just talked about hotels, right? I always pack my own food to the airport. It's really hard. Nowadays, it's a little better. There's some places, but especially if you're going on a long transatlantic flight for 12 hours or something, I always take food with me because I don't count on the fact that I can find good, clean, organic food sources. And so that takes planning, right? That takes an extra cooler bag. That takes an extra hour to prepare the food to put in my bag to take to the airport. So these things, though, if you're not thinking ahead and planning ahead, you will experience failure, and you'll experience just, oh, I'm hungry, I'm going to go get the fast, quick thing. And we're so used to food being so convenient. Even organic produce shipped from, say, California on a truck is convenient because whether it's in season or out of season, we can get fresh berries, right? But it's not as good as finding a local farmer, taking the time, or getting a CSA where you're getting food delivered that's local and organic and just picked out of the garden. Those are going to be much more nutrient dense, and those polyphenols are going to feed our good microbiome. But all of that takes time, energy, planning, sometimes more money. So it is navigating what really matters. And if you really value your brain and your health and your hormones and your healthy weight and body composition, you must put in a little time and energy into what we're putting into our bodies.
Yeah. 100%. I could not agree more. I mean, your body, I say this all the time, like people spend hundreds of thousands of dollars on cars and they wash their car every day or every week. And, my husband makes sure his car's washed every week and, making sure the oil's changed and all this. You can buy all the cars in the world. Your body is like, you get one, right? So the people who are like, oh, I don't have time for that. It's like, well, okay, but you're going to be in the mechanic shop for a long time when you're older, right? That's how eventually they end up with me or you because traditional medicine fails them and they've been in every clinic that they can think of. And all the doctors just scratch their head and give them more medicine, more poison, more toxins, point to another doctor, and they never get better, right?
Yeah. I was joking. I'm sure you've heard this. It's like you pay the farmer now or the hospital later. But one of those ways you're going to kind of like, and honestly, the truth is if you learn how to, whether it's sprout your own vegetables, grow some herbs, find the local farmers, share someone, a quarter of a cow or, but there's so many ways to do this that are very affordable and sustainable. And even if you can't afford all organic, at least you can look at the Environmental Working Group puts out the Dirty Dozen every year. Those are the top fruits and vegetables sprayed with pesticides, and at the very least pick those and buy organic. There's ways that you can do it that make it a lot more affordable.
Yeah, I completely agree. And I'm the same way, like whenever I travel, I always take my little food bag.
Yeah.
People laugh at me. I
I
don't
know.
care. I'm just like, whatever, pulling my
Yeah.
stuff out. Like, you're not catching me eating anything at an airport or on an airline, for
Oh
God's
yeah,
sake.
that's the
Like,
worst when you're stuck on
I
a.
mean,
Yeah.
I recently was on a flight on American and it's like, would you like a snack? And I look at the snack basket and I'm like, I will give him this. There was a turkey jerky in there that wasn't like awful. It was I mean, it was wrapped in plastic. But I was just like, everything else was, complete garbage. Of course, they have like nuts, but if you look, they're like smothered in palm oil and, maybe have a little bit of sugar and all these things. I'm like, dear God. So do you think that people can treat their chronic illnesses, whether it be mold, cancer, just fatigue, whatever? Do you think that treatment should include cleaning out their gut and or like certain nutrition plans? Do you think that that's like woo woo? Some people, I get people who say, well, I think you're just, that's very woo woo. Like you don't have to do that. What are your thoughts on that?
Oh gosh, I could not agree more. I think it's not just optional, it's an essential part of, and you started talking about mood and brain, and there's a whole new science of psychobiotics, meaning like the gut microbiome in the brain. And we have so much data. I've been doing presentations the last several years on gut-brain connection with how our gut and brain talk to one another through neurotransmitters, through hormones, and through the vagus nerve. And it's a bidirectional communication, which means if we have an unhealthy microbiome or we're not taking the right probiotics or we're eating the wrong foods, it absolutely affects our brain. It creates more proneness to depression, anxiety, even things like bipolar and schizophrenia. So it's very connected. And I think we can just look at statistics to see the huge increase in incidence. I think since the pandemic, about 400% increase in prescription antidepressants because people are experiencing more depression and anxiety. And even with mood disorders, I always start with the gut.
I couldn't agree more. I see, I saw somebody today who's like, my mood is terrible. And I looked at all of their labs and I'm like, your labs aren't terrible. She had some micronutrient deficiencies, probably because I think she has a bad gut. Her sex hormones were a little off. Her testosterone's a little low, her estrogen's a little low. That's also going to make you feel bad. And in addition to that, when your hormones are off, it's also going to affect your gut, unfortunately. But, I always start with the gut as well. Like, how is your gut doing? Because if your gut isn't working and we're not absorbing micronutrients, then we can't make dopamine, we can't make serotonin. And so I think it's very powerful and so important. And I'm actually getting psychiatrists that refer me patients now in Oklahoma City, which is amazing because it's like, no, you don't need, there's not an Adderall deficiency. There's also not a Zoloft deficiency. I mean, some people may need these medications, not trying to like discredit that, but I think it's highly overprescribed.
Oh, I couldn't agree more. I mean, years ago when I started, it's been like 20 plus years, but I would get the moms sending their college kids in and they'd have a little anxiety or depression. And I'd talk to them and get their history and they're like, okay, let's do a stool test and organic. And they just look at me like, what? I came in with anxiety or what are you doing with a stool test? And now it's more common. But I remember trying to explain years and years ago that I need to know your microbiome. It starts there. And the first thing I would do with someone depressed or anxious is look at their gut. So I couldn't agree more. And only the data, even 20 years ago, has only exponentially increased in the proof of concept of why the gut is so profoundly impactful for our brain.
Yeah. Did you use any sort of special gut modality tricks or tips to help with your breast cancer and or your Crohn's disease now? Like I'm assuming it's pretty well in remission. You don't have a lot of issues, hopefully.
Yeah, both are gone and I'm completely in remission. Actually, I consider it cured. Some people say remission from Crohn's, but it's not there anymore. So yes, and what happened, I'll do the short story, but basically breast cancer, and then I had 3-drug aggressive chemotherapy, and some of those actually induced a more permeable gut. Unbeknownst to me, I was undiagnosed celiac, so I'd been eating gluten. I didn't know that gluten was a big trigger for me. I had a severe B12 deficiency, severe zinc deficiency, severe hypochlorhydria, was just low stomach acid. So all these things were brewing, as a 10, 12, 14-year-old before I ever got diagnosed with cancer. And then the cancer and the treatment took me into severe leaky gut on top of a celiac undiagnosed. And then when I presented with Crohn's, I basically had to start over and say, okay, what is going on with my gut? And so the cancer treatment led to the diagnosis of Crohn's. Now, I might have gotten that anyway because I had a high-risk gene called NOD, which made my own immune system react more aggressively to normal microbial contents. So then you throw in the permeability from the chemotherapy, and it was a perfect storm. So after my diagnosis of Crohn's, I remember asking the gastroenterologist what kind of diet I should be on. He completely blew me off and said, Jill, diet has nothing to do with this. And that was my first aha, being like, that can't be right. And so I went on my own journey, found some dietary changes. I took out gluten, took out dairy, took out soy, took out corn, took out a lot of allergens, started to clean up my microbiome. I had yeast overgrowth, I had bacterial overgrowth, I had parasites at one point. And I did all those things over probably 2 years' time. And by that time, I really was free of symptoms, but it really has been probably a decade of work on my gut to get it to the point where I can eat, freely. I still eat a really clean diet. I'm not on any dairy or gluten. I'm all organic, whole food kind of diet, but I don't have any gut symptoms, which is pretty profound after having been diagnosed with Crohn's disease.
Yeah, I love that. Well, thank you for sharing that. So I'll link all of our stuff in the show notes. I think I just wanted people to kind of hear your story and hear how you think the gut affects a lot of things, as well as somebody who takes care of a lot of really sick people and a lot of people with mold. I end my podcast every time with 3 questions, and I don't want you to overthink it. I just want you to tell me what comes to mind, but tell me one tell me one food that's most beneficial and why.
I would say wild salmon. So many omega anti-inflammatory components there, and you're getting that good protein. And I think most of us as women are not getting enough protein. So I would say wild salmon.
What is one thing that anyone can do that will improve their health that's 100% free?
Sleep. Sleep is like my number one thing that I think people, now again, that can be difficult because a lot of people don't sleep well, but I would say always when someone comes in, no matter how complex their situation, I always start with quality of sleep because I know that's where repair occurs. That's where the brain detoxifies, the liver detoxifies. So you must be sleeping adequately in order to heal.
I love that. I could not agree more. And then what is one thing that you wish you would have known about your health 20 years ago that you would have done differently?
You know what I found in the last maybe 5 years, and I've been doing this a long time, I have done gut issues and cancer and all that kind of stuff, but what I've seen in the last several years that's so profound for healing for patients is dealing with our patterns of thinking, our identity around illness, and our traumas. And so back in the day, years and years ago, I was a workaholic. I was, perfectionistic, all these kinds of things, very driven. And it got me where I am. But in order to really heal at the deepest level, I had to go back and reprogram all of those parts of myself. And I feel like I'm so much healthier. And I feel like even with my patients, the most profound changes come in re-examining somatic patterns of trauma, somatic behavioral issues, and even just identity issues around illness. And sometimes that can be a bigger shift than even, taking a probiotic for the gut.
Okay, so that goes back to the mindset, I would say. Okay. Do you have a favorite book in closing? I want to start asking people this. A favorite book that really changed your life, whether it be something about medicine or whether it just be something that you read in general that you really like?
Oh, I love books. So this is a hard one. Two things come to mind. There's multiple books about flow, probably the original with Mikhaili Csikszentmihalyi, who passed away when I was writing my book. It's just called Flow. But also Man's Search for Meaning by Viktor Frankl. I love profound, deep, thoughtful books about transformation, and those two have really changed my way of thinking.
Okay. Well, thank you so much for coming on the podcast and having this conversation with me. I appreciate it so much.
You're welcome, Cassie. Thanks for the great work you do in the world and your patience in getting me on here.
Yes, thank you for what you do as well. I appreciate it. I hope that you enjoyed this episode as much as I enjoyed my conversation with Dr. Jill. I wanted to put this together for people because I have a lot of you who reach out to me and say you feel very overwhelmed. You feel very just unsure as to what to do. And you have lots of chronic illnesses, whether they be autoimmune, mold, toxicity, etc. I really like her take on looking at your health as a bucket. And when your bucket starts overflowing, figuring out ways that we can take water out of the bucket to get better. So I hope that you can look at your air quality, your food quality, your water quality, and you have some easy, actionable tips that you can take in order to make your health better. Please, please, please share this with anyone that you think it would help. My mission with this podcast is to get people good information and to help make them healthier. And I need your help to do that. So please share this. Make sure you're following us on any podcast platform that you use. And also please leave me a review. If you leave me a review, I know that I'm doing what you want me to do. Make sure that you follow us on social media and let me know who you want me to interview and what questions you want me to ask. I've also started doing webinars where I answer a lot of questions that you guys ask. And so make sure if you're following us on social media that you sign up for those webinars because I get those questions directly from you guys. And a lot of times we do live Q&A as well. Remember that Modern Endocrine has a license in 39 states now. We are more than happy to help you with any complex medical problem that you have. And if you are struggling with gut issues, we have a phenomenal gut health program, which we can actually offer to anyone in all 50 states. I have a health coach who helps me with that. We have an app and a private Facebook group, and it has a phenomenal success rate. So make sure that you stay in contact, reach out if you need help with any of this. Everything that we talked about will be linked in the show notes. I hope that you have a wonderful week, and thank you for joining me on this episode of Hormones, Metabolism, and You. The information presented, including any materials discussed, referenced, or linked within this podcast are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.